At Summit Eye Care, we are proud to offer the ability to customize your journey. Cataract surgery is not one size fits all. It's not, what we think of cataract surgery, how it was 10, 20, 30, 40 years ago. How would you describe custom cataract surgery?
Originally, cataract surgery was simply to remove the opacity that was in the lens and would replace that with an artificial lens, but we knew that glasses would be a part of the expectation. But now we have the ability to take the refractive error, and that would be what your glasses, your contact lenses used to do, and put that into the implant so that you are free from the use of glasses. It's a whole nother level of opportunity to refresh the way you see the world.
We want to be able to provide a lifestyle. So the question you have to ask yourself is, do glasses bother you? Do you want to get out of glasses? Do you want to reduce your dependency on glasses? Do you want to eliminate them completely? We have an option for you, and that's what this journey is. That's what this discussion is about.
So the opportunity to provide clear, quality vision without the need for something, whether it's glasses or contact lenses or reading glasses, those are all things that work. They work well. But if we can provide natural vision like many have enjoyed when they were a child, where they didn't require something to go about their day, we can do that with custom prescription implants. The ability to provide a premium outcome now exists.
The first option for every patient is a more traditional approach. Traditional cataract surgery is what's covered by insurance. There is deductibles and copays still apply, but a traditional procedure is a fix of the lens. It's a fix of your cataract. However, what is something that somebody could expect with a traditional procedure?
Well, it'll get rid of the night vision issues. It'll get rid of some of the glare. But what we're taking is an off-the-shelf implant that they come in certain sizes. There's nothing custom about them. We'll make the vision better, but glasses are an expectation following the use of a standard lens. So there's really no promise or guarantee that someone will be free of glasses after that. But the glasses will work and they'll see better. The big advantage of the traditional lenses are that they're covered by insurance.
The big advantage of the traditional option is that the glare and the halos, the reason that you're having cataract surgery in the first place, that will get better. Your vision will improve. The expectation is that you still will need glasses.
So the traditional surgery is still what the majority of patients ask for. And the reason being is that it is covered completely by insurance. And so that we totally understand and respect that as the primary driver, and the fact that glasses are necessary, it's not the end of the world. And so you'll get good quality of vision with the traditional lens. That next level of upgrade, it's a lifestyle choice, it's a personal choice that people will say, what is the value to me if for the rest of my waking days I can be free of glasses and have natural vision? And for many people, they'll say, well, that makes perfect sense. If I can achieve that, it's a gift to myself that'll last me the rest of my life. That sounds good.
It's an investment. This is a once-in-a-lifetime procedure. This is a one-time deal. You don't have this procedure with the expectation of needing to redo it in 10 years like you would a knee replacement or a hip replacement. You may have to have that redone. This is a one-time deal, so if you do decide to go for an upgrade, it is an investment.
And that's a really important point. It doesn't wear off. It doesn't stop working. It is not temporary. It is literally for the rest of your life. That refractive correction will be corrected, and it won't shift, it won't change.
Mm-hmm. Our goal is to leave you with as small of a prescription as possible. That's always our goal with the traditional procedure. However, the expectation is glasses will still be necessary, both for distance as well as for reading, and pretty much everything in between. So most people end up with a progressive lens or a bifocal after surgery.
And again, that's not bad. Again, many patients have had that for years or most of their adult life, maybe all of their life as well anyway. So it's not a problem, but it's an expectation. If you're looking to provide the next level, the premium level, to say, all right, I'd like to see naturally. I'd like to not have to worry about using something else in order to see clearly. And I can achieve that and get rid of my cataracts. That's the next level of opportunity that comes with a custom type implant.
So the second option that we have is our astigmatic option. And there's a couple ways to do this, but can you tell me what astigmatism is?
So astigmatism is an irregularity of the shape of the front of the eye, of the cornea. So under perfect conditions, the cornea should be round, sort of like think of a baseball or a basketball, where it has the same curvature all the way around. You can't point a basketball. Astigmatism is when the cornea, the front of the eye, is more shaped like a football. So there's a steep and there's a shallow curvature. And you can point a football one direction or the other, and that would be the concept of astigmatism. It's what causes a blur at the end of the day. It's just one more element that needs to be corrected to give sharp focus.
For people electing an astigmatism treatment, their expectation should be that we probably can get you out of glasses for driving. You probably don't need glasses to drive, at least in good daylight. That's our goal. You may have a light prescription, a very thin pair of glasses at nighttime, and you still need reading glasses, but you're starting to reduce your dependency on glasses at the very least.
There's a huge advantage to having no astigmatism. Whatever small prescription there may be, it's easier to fit, it's easier to get used to, it's easier to accommodate what is necessary to provide good quality vision. So that is sort of a baseline in terms of creating a better quality of vision, is to not leave that component behind, to not leave the astigmatism behind.
We can do astigmatism treatment with a laser. The laser does two things. It makes the procedure a little more predictable, a little bit quicker visual recovery, and now we can also be much more accurate with our refractive component. So again, leaving you at least less dependent on glasses. The downside of this is that it's not fully covered by insurance. There is an out-of-pocket, and that's something that we'll talk about more case by case.
The laser correction of astigmatism is really remarkable technology. There is a robotic component to this in which we take images of the cornea that are then translated into the laser instrument. It then registers exactly where the astigmatism is and then programs the treatment necessary to neutralize or minimize the astigmatism. Very high tech and very accurate.
Our third option, our highest customized option, is the light adjustable lens. The light adjustable lens allows us to have the highest level of precision in a refractive space that we have possible in cataract surgery. So for patients who are looking to reduce their dependency on glasses as much as possible, this is probably the best outcome or the best option.
The light adjustable lens is exactly as it sounds. It's adjustable with light. So when we look at a refraction, and everyone's had that done where you better one, better two, and you say, what do I like? And there'll be a set of numbers that are generated by that refraction. And those numbers are what are used to make a prescription for glasses. Well, instead of making glasses, we program a very high-tech deformable mirror that takes the wavefront, the high-tech wavefront of that refraction, and it creates a UV light that we can shine onto the implant. Essentially, we're making glasses on the implant. It is extraordinarily accurate.
So the appeal is somebody who has a really high distance demand. We can get out of distance glasses pretty confidently. If they want to start to get away from reading glasses, we can do that too. We can start reducing your dependency on reading glasses. Now, I don't want you to think that you're never going to need reading glasses. You probably will need reading glasses for some small print, but we hope that you leave them in the drawer for a majority of your day. That is our goal with the light adjustable lens.
So the majority of patients will have very functional intermediate and near. For that I mean they can see their watch, they can read their phone, they can see the speedometer, they can read the menu at a restaurant or the prices at a grocery store, the sort of things that are just day-to-day issues that you face. And if you're going to be like, reading a book for 5 hours in front of a fireplace in dim light, yeah, maybe a very thin pair of glasses. It's the best possible situation is to be 20 years old and have been born with perfect vision. We can't quite do that yet. We can come pretty close.
That sounds fantastic. So with the pros, there are some cons. There are some things that patients should understand. It does take some time, and that's not necessarily a bad thing. The whole process from surgery until our last adjustment takes about 6 to 8 weeks, give or take. That's your ability to test drive it, though. I don't think of that as a negative, but it is a logistical burden that some, may not fit everybody. The other part of it is that you do have to wear some special glasses outside, just outdoors. They look like sunglasses. They're not the worst things in the world.
But only outdoors, only during the day, and it's only temporary. And so it's a journey that we take together, but the fact that it takes a little bit of time, you'll still have good vision the entire time. You'll never be without good vision. It's just we're going to tweak it to the point where you are seeing the best you've ever seen in your life. So I can tell you, we take care of a lot of golfers, right? I mean, that's just such a part of our culture. And the only complaint I get from golfers is that they are now responsible to watch everybody else's golf ball.
I hear that all the time.
Yeah, and it's like, it's like the other 3 people I'm golfing with, now I have to follow what they're doing because I'm the only one who can see it.
We won't take the blame if your golf game gets worse, but we will take some credit. That's okay. So the fourth category is our multifocal or extended depth of focus category. Now, this probably provides some of the widest range of vision. You get good distance, good intermediate, and good up close. So a good level of independence from glasses.
So there is certainly a space where this is the best choice. And so if it's confusing to say, well, should I have just the astigmatism or just the light adjustable or just a multifocal, that's why we need to speak face to face. We want this to be exactly what you need to optimize your lifestyle and your vision. So yes, there are choices, but it's not like you have to choose without input and without the ability to understand. We can provide you with the technology that we can provide to get to that point and help you make a decision that you feel not only good about, but gives you exactly what you're looking for.
Exactly. So the upside of multifocal lenses are that you get a good range of vision. The downside is that you may have some glare and some halos. So people who spend a lot of time out driving at nighttime, there sometimes is some halos, and that's temporary. Most people adapt to that very, very well. The other upside is that it doesn't take the runway that the light adjustable lens takes. If you don't have 6 to 8 weeks, if you're leaving on a trip or moving, or you don't have that time, this is a one and done thing. You don't have to come back for those subsequent adjustments. So that is an advantage for some patients, right?
There is an advantage, and there's really, the upside is the quality of life that any of those options provide. And then it's a matter of, well, what fits your lifestyle, what fits what you're looking to achieve, and we can provide you not only with the options, but the advice that will help you find the right choice and develop the vision that will serve you the rest of your life.
Whether you go a traditional method or you go with one of the advanced options, it is not one size fits all. Cataract surgery is purely an opportunity. It is an opportunity to match your lifestyle, match your vision to your lifestyle. And this is a decision that shouldn't be taken lightly. It's taken with the support of your team, you and I, your family, everybody else involved in our clinic. This is a big decision.
We're going to work with our patients to make sure that they achieve the goal that they are setting for themselves. And we will provide the best care, the best advice, and our patients do extremely well. The premium lenses are a great choice, but the issues involved with, sometimes there's a cost associated with it. And then it becomes a matter of, do I feel comfortable with that? Is that something that makes sense to me? And where are my priorities? And completely respect that. You can't make a bad choice. We can help you find the right choice for yourself. We pride ourselves on providing the best possible care, and it is a team approach. We work together with you, with your primary care doctor, and we will find the choice that gives you the quality of life, the quality of vision that you're looking for.
I think you said something right there that was really important. You cannot make a bad decision. The decision to do something, there's a reason that you're here. The decision to do something is important, and you will be happy with whatever happens. Now the question comes to just lifestyle and how you want to customize this.
And I'll put in just a little bit of a plug for Dr. Bruns. Dr. Bruns is the most experienced doctor in treating for the light adjustable lens in the entire United States. Constantly invited to give seminars and teach other doctors. We have other doctors who come in to learn from what you have been able to develop as the right technology and the right techniques. So for me, it's a privilege to have you as a partner and an associate. For our patients, it's a great plus to have someone with so much experience.
It's a team sport. You and I have the most experience in the entire country doing the light adjustable lens as a team. It's a team sport. I'm part of that team, you're part of that team, our entire staff is part of that team, the patient and their family are part of that team too.
We look forward to seeing you. We look forward to working with your primary doctors on a go-forward basis. Together, we're going to achieve a better quality of life.